Hi, my name is Carla Beaton, and today we're going to talk about the Better Coordinated Cross-Sectoral Medication Reconciliation Initiative. Well, that's a mouthful, so we shortened it to BOOMR. BOOMR was born out of a program called IDEAS with Health Quality Ontario. IDEAS stands for Improving and Driving Excellence Across Sectors. BOOMR won the Alumni Award and was recognized on the Honor Roll for the Minister's Medal, making it one of the top 10 quality initiatives in Ontario for 2015. It's a project that started as a collaboration with one pharmacy, one long-term care home, and one hospital. Then it grew and grew and grew. Before we get into the project, let me tell you a patient's story. It was a really nice day. Then Robert wasn't feeling like himself. He was lightheaded, dizzy, and felt chest pain. Robert fell and fractured his hip. Luckily, his daughter was there, visiting and helped him get transferred to the hospital. They fixed up his heart and repaired his hip, but he was unable to walk on his own. The complexities of his diabetes, COPD, and dementia resulted in the need for a discharge to the long-term care home, where Robert would have round-the-clock supervised care by qualified nurses, physicians, and pharmacists. Long-term care is a comfortable, caring environment where people call home. However, the transition is not always so simple, and evidence shows that there can be problems with communication and documentation due to inaccuracies with transfer forms. Now, there's evidence that patients are vulnerable to harmful medication errors during transitions from hospital to long-term care. Poor communication across the care settings and lapses in documentation have been found to be the most frequent causes of med errors during transitions from one care setting to another. For each patient, or resident as we call them in residential care homes, there are many sources of medication lists depending on what care settings they have visited. So, there's Robert's pharmacy, there's a hospital medication list or discharge summary, there's the care coordinator's medication list, and then there's Robert's own supply from home, which could be from a few pharmacies. The pharmacist interviews Robert and his daughter to find out his perspective, what he recalls about how he takes his medication, and if he has any needs that aren't being met. But Robert may not always be able to talk, and his daughter, who has not lived with him for over 30 years, may not be aware of all the details of the medications either. Failure to catch the discrepancies means important information may go unnoticed and contribute to adverse drug reactions that could lead to a hospital visit or polypharmacy, which means too many medications. So this is why we do something called medication reconciliation, or MedRec for short. MedRec is a patient safety initiative that aims to minimize adverse events experienced by patients as they transition within the healthcare system. BOOMR MedRec is a practice change that drives improvement in medication safety by coordinating 4 sectors of healthcare: care coordinators, hospitals, homes, and community pharmacies, with the patient at the center to reduce those hospital visits, system costs, and unnecessary medications. So how does this MedRec work? Well, it's a 3-step process. 1. Create an accurate medication history with at least 2 reliable sources by interviewing the patient and her family and gathering the lists. 2. Compare the information, identify and resolve all those differences or discrepancies. 3. Document the recommendations and communicate any changes to the patient or family along with the next provider of care. With BOOMR, we're interested in improving the quality of the MedRec process by reducing or stopping the chance of those drug reactions that can lead to hospital visits and too many medications, called polypharmacy, before the resident moves into the home. BOOMR improves communication within 48 hours before move-in. So on bed acceptance day, the home provides the community pharmacy with all medication sources, especially the previous pharmacy records. Then, the home notifies the resident or family that they can engage in a call with the pharmacist before they move in. And we needed a way for 3 people, the pharmacist, prescriber, and nurse, who do not always work in the same place, to have a quick, concise conversation about the medication discrepancies and orders. We called this the trio call. BOOMR also reduced waste in the healthcare system, like defects, time spent doing something incorrectly, by only sending the pharmacy the 9 necessary RI-HC assessment pages instead of 33 pages. And overproduction, doing more than what is needed by the resident, by having all of our information before we talk to the resident or family member. We reduce waiting for the information from each other or the next event to occur by coordinating the process to start early, about 48 hours ahead, and conducting one trio call when all the information was in place. We eliminated over-processing, which is work not valued by the patient or resident or aligned with their needs. The community pharmacists organized the medication to get it right the first time, avoiding the time and money wasted as a result of drug errors or the cost if there was a hospital visit. And finally, maximizing the human potential, which is waste or loss due to not engaging residents or families or staff by listening to their current concerns and ideas. In our story, Robert's interview with the community pharmacist enabled him and his daughter to be more clear about his medications, why they are needed, how to prevent another visit to the hospital, and how to be engaged in all aspects of his care to get the outcomes he is looking for. So Robert mentioned that in the hospital he was shown a poster from the Canadian Patient Safety Institute and the Institute for Safe Medication Practice that taught him the 5 questions to ask about his medications when he sees a physician, a nurse, or a pharmacist. The 5 questions you need to ask are, what are the changes to my medication? And have any been added, stopped, or changed? What medications are to continue, and why? What is the proper way to take medication, and for how long do I need to take them? Is there anything to monitor with lab? And how will I know when the medicine's working? What side effects should I watch for? Is there anything to follow up, like tests? And when do I book my next visit? With BOOMR, we can work together across disciplines to ensure patients and residents and families receive the highest quality of care. So now you know about BOOMR, the Better Coordinated Cross-Sectoral MedRec. With a patient-centered approach, this redesign of key process steps of MedRec demonstrates improved patient engagement using the patient story, increased quality of communication, improved workflow efficiency, demonstrated cost savings to the system, proving value for quality. Thank you for listening, and I hope you're interested in BOOMR.